Can you have a look at the canister, the outflow pump? It's making noise. Okay, it's Dr. Buford. We're just getting started on the right shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And we're going to go ahead and start working here. That shaver you see is working on the anterior glenoid where you can see some of the cartilage is real loose. And we just don't want to leave anything that could become a loose piece. And so this is what arthritis tends to look like. The cartilage gets soft and then sometimes just goes away. Now we're going to pull back. We're going to look at your biceps tendon and this superior labral area here. And what we see here is your biceps is very inflamed. See the redness around it? And even has some tearing. So we are going to do a biceps tenodesis because I did help you on the other shoulder. So we'll get ready to do that. This is the rotator cuff tear at the top of the screen here. Right where my shaver kind of disappears is where that tear goes all the way through. So before we do anything else there, we're going to look around the rest of the shoulder inside the joint here. We can see a similar amount of arthritis on the humeral head. See where it's kind of thin there? Back of the shoulder. We can see some areas where the cartilage isn't smooth also. So we'll keep working here. We'll show you some more in a little bit. Okay, so we've released the biceps tendon. You can see it's gone now. That's actually the end of it right there. You can see the sutures in it. And we'll need a blue dry dock. And there's the area in the anterior glenoid that we had to debride because the cartilage was not in great shape. I'm just going to do some final smoothing here. There's kind of a corresponding kissing lesion right above it on the humeral head. And then as we look towards the back of the shoulder, I just want to see if there's anything else significant that we should get. Yeah, we'll go ahead and take a switching stick here. I'm going to put the camera in the front and put the cannula in the back, so 2 switching sticks. And we'll put on the video for a minute. Okay, so now we're looking from the front to the back, and you can see why it's important that we do this. Not only can we see a bit more injury to the articular cartilage back here. Can you lift straight up on the shoulder? Yeah, straight up. So we're working hard on that. But then we can also see that this rotator cuff tear really extends a bit more posteriorly than we were hoping. Because all the way back here, this is detached. And as we look here, you can see how this is delaminated as well. So we've got probably 2 anchors to put in to fix this. We won't make that final decision until we change positions with your shoulder and look from the top down basically. But here you can see the injury. Okay, so we'll go off on the video. The next thing we show you will be up in the subacromial space. Okay, so here's the tear. This is anterior to the right, posterior to the left. You can see we've got a blue, what we call a dry dock cannula coming in the back. As I rotate the camera around, you can look at the top and see that we've taken off some bone from the acromion. Those are our biceps tenodesis sutures, and there's the anterior cannula, and here's the anterior extent of the tear, all the way up to the biceps tendon way up there. So we've got a good-sized tear, a big tear. And what we're going to do next is, now that we can see the tear and know how we're going to place our anchors, we're going to make a little nick in the skin with a scalpel, and then we'll place the guide. Pull. And then we'll place the guide for the anchor. There it is right there. And now we're going to go ahead and make sure that we can see the posterior extent of the tear there, which is all the way back to there. We're going to place our first anchor down right about here. So we'll go ahead and hold this down against the bone. We'll pull that out, put the anchor in. And then just give me some gentle taps. And we'll show you some more in a minute. Okay, so here's the anchor in the bone. It has 3 sutures. I like the position. We're just a few millimeters off the articular margin. And now we're going to get to work passing some sutures. We'll show you some more in a minute. Okay, so here's our suture hook. This one's kind of straight. It's got a sharp tip. It's the smallest device we have to pass suture through the tendon, which is why I use it. It's loaded with a black plastic-coated wire called a super shuttle. And the basic idea is we're going to come down here, rotate, and then the tip of it should come out right about there to give us a stitch that looks about like that. So on the right side of the screen, which is the front of your shoulder, I've got a grasper that can help me do that. So there we can lift up, we can see the tear. Hold the camera right there. And then as we pull back, there you can see the needle coming underneath like it's supposed to. So we'll feed that relay. And retrieve it, and we'll show you some more in just a little bit. Now go ahead and, if you take this, and just about 1 inch, so just about that much through right there, and then just hold on to it. Yep, and then just hold it right at the eyelet like you're doing, and then just keep holding. So now we're going to pull back. And then what it does is it brings that suture underneath. Let me show you here. So now that suture's coming out here, and it's running underneath. So I'll get the crochet hook next. Because this is such a big tear, we're going to tie this first suture first before we pass the other ones, because it'll give us a good posterior anchor. So there you can see the loop, and now we're going to tie that knot down just like that. Hold the camera there. Okay, so we're all done here. Let me show you what we've accomplished. We've got 2 anchors in and a total of 6 sutures. We're just rotating the shoulder. That's the anterior anchor there. That second solid blue one is the biceps tenodesis anchor. So then as we rotate towards the back of the shoulder, you can see the posterior work that we've done. And that hole that was there is essentially completely gone. It used to be right there, but it's completely covered up. So I'm very happy with the way that looks. We're going to get you back to the recovery room shortly, okay? Good luck to you now. Bye-bye.